Baptist Medical News Network. I'm Rhonda McRae. Thank you so much for joining us today for our live seminar. Our topic today is family history of heart disease. And to help us today, we've got cardiologist Dr. Doug Harkins. Thank you so much for joining us today. We're glad to have you here. We're going to jump in just a second, but before we do, just three quick housekeeping matters. First of all, if you may notice on the viewer that you're seeing some advertising scrolling across the screen as we go. If you do, that is not associated with Baptist. That is with Ustream TV that provides the streaming capability for what we're doing today. So that's not Baptist. That is for Ustream. Second of all, you can post a question on this page for Dr. Harkins that we'll be checking questions at the sort of near the end of this webcast. So if you have a question for him, you can post that at any time. Go ahead and do that. After you hit submit, you're going to need to hit the play button again on your viewer to restart the broadcast, the webcast. But go ahead and post your questions now and we'll get to those. And lastly, we are recording this, so if after the webcast is over, if you have a friend that you think would benefit from seeing this that might have missed the webcast today, you can come back to our website later in the day and we'll have the recorded version of this webcast up and running on our website, and be sure and email that link to your friends so they can benefit from it too. So with all that, let's go ahead and get started. We've got a lot of ground to cover. So Dr. Harkins, first question, family history of heart disease. Let's identify for the people who are watching, let's define it. It's family history of heart disease. Is that, I've got one second cousin with high blood pressure, or does it mean everybody on both sides of my family for 3 generations back have had heart attacks?
When we talk about family history, what we're talking about are first degree relatives, meaning parents, brothers, and sisters.
Okay.
Now, obviously, we want to know about your extended family as well, like grandparents and cousins. The closer that someone is related to you genetically, the more likely you are to share the same disease processes.
Okay.
So when we're really talking about family history, it's your parents, your brothers, and your sisters that we're really most interested in.
Okay. So if my mother and my father both have had heart attacks, and my older sister has had a heart attack, then I've got something that I need to be looking at.
Absolutely.
Okay, all right.
Absolutely. Family history is extremely important. Genetics play a significant role in the development of coronary atherosclerosis, or hardening of the arteries. It's not the only risk factor. There are a lot of other risk factors that go into it, and generally people in the same family have the same risk factors like hypertension, high cholesterol, diabetes, and they all play a role.
Okay, well that was actually a question I was going to ask you, is if you have this family history, what does it kind of look like? How does it show up?
There have been some studies looking specifically at the genetic link. There have been some studies with patients with no risk factors for coronary disease, meaning no hypertension, no diabetes, no high cholesterol, just a family history of coronary disease. And the thought right now is that there's about a 15% risk of coronary disease attributable solely to family history. So it does play a significant role, but like I said, most patients with a family history of coronary disease also have other risk factors such as diabetes, hypertension, high cholesterol.
So you can inherit like a tendency for high blood pressure and high cholesterol?
Absolutely.
Okay.
A lot of these disorders that lead to coronary artery disease are inherited disease. Now, a lot of them are also things that we bring on ourselves, such as smoking and sedentary lifestyle, or not exercising enough, obesity. All of these things that we can help prevent, we're not doing enough of.
If you are doing the things you're supposed to do, you're not smoking, you're exercising, you're at a good weight, is a family history of heart disease, is that risk factor enough alone to make you need to pay attention to it?
Absolutely.
Okay.
Absolutely. Family history is a very strong risk factor, and like I said, there's studies that show up to 15% of people with solely a family history of coronary disease have the propensity to develop significant coronary disease. And if that's your only risk factor, you still need to make sure you seek appropriate screening.
Okay, well, let's talk about that. Let's jump right into that. So we've identified who these people are with a family history of heart disease. What steps should they be taking to kind of get a handle on it, and at what age?
Well, obviously the first thing you can do is a healthy lifestyle. Eating right, exercising, keeping your weight in the appropriate range. As far as medical screening, checking for high cholesterol or high triglycerides is important. Smoking cessation if you smoke. Monitoring your blood pressure and treating that if it's elevated, as well as diabetes, and managing and preventing that.
Okay, so you need to know what your cholesterol is, you need to know what your blood pressure is, and you need to know about the blood sugar. So those
Absolutely.
are some things that you need to be following.
Right.
At what age? Say I'm the daughter of a man who had a heart attack at age 45. Should I start tracking that when I'm 25? Or kind of what's your recommendation there?
Well, opinions are going to vary on when you should seek appropriate screening. Generally, once you're an adult, when you're 25 years of age, you need to be seeing a primary care physician for routine screenings for things such as high cholesterol and diabetes. And also, women out there are going to need to see their OBGYNs to have their routine screenings and mammograms and things like that. But generally, around age 25, you should see some sort of primary care physician. Make sure you don't have diabetes, high cholesterol, high blood pressure. And then after that point, depending on what that shows, every 2 years until you probably get into your mid-30s. Now, that's just the general population. If you have a strong family history of coronary disease, meaning a parent or a sibling that had heart disease in their 40s, by the time you're 30, you need to make sure that you aren't on the same track that your relative was.
So is there a difference between a family who might start seeing heart trouble in their 60s versus a family that typically sees it in their 40s?
Well, nothing you can look at and see just looking at the family, but generally the people who have heart attacks in their 40s, they're generally going to have diabetes or high cholesterol or hypertension or smoking history or some combination of those things that lead to coronary disease at such an early age. Pretty uncommon to have a very healthy person have a heart attack or coronary disease at that young of age without some other risk factor.
Okay, all right. But earlier sort of, I guess, for lack of a better way to put it, earlier onset of a heart attack doesn't necessarily mean that there's a stronger genetic tendency toward it than families who have it later in life.
Well, right now, the genetics of coronary atherosclerosis or hardening of the arteries is, still in its infancy.
Okay.
There have been some, genetic studies that have identified certain genes that, certain families have that may indicate a propensity to have coronary atherosclerosis. But right now, this is something that's being studied all over the world. They've identified certain cancer genes. Right now, we have not identified any heart attack genes.
Okay.
But there are people out there looking, and that will definitely be something worthwhile.
Okay. All right. Well, let's talk a little bit about some screenings here we have at Baptist, and then we're going to jump to questions because I know we already have at least one question. But talk a little bit about the value of the screenings for people that we've identified have a family history of heart disease. And we need to talk about a couple. There's the Everyday Heart Day program and then the calcium scoring screening, and maybe identify kind of how you would track people to one or the other of those.
Okay. Well, with the Everyday Heart screening, you get a fasting cholesterol check, you get a check of your chemistries, you get an electrocardiogram or an EKG, and you also get a screening questionnaire to kind of identify some of these risk factors we talked about. And it's very inexpensive. I think it costs $25 to have that performed.
Right.
The value of that, is immense because it can identify your propensity to develop coronary disease earlier, and it's also an extremely low price for that. Now, the coronary artery calcium scoring is fairly new, and what it is it's a CAT scan of your heart that helps identify coronary disease earlier. All these other tests we've talked about help identify risk factors. This lets us look at your heart artery and see if you have coronary disease. Coronary disease is a very difficult process to explain, and we really don't fully understand it. But essentially, a heart artery is a 3-layered muscular tube, and as you have these risk factors for coronary disease, cholesterol gets deposited inside the wall of these arteries.
Okay.
Now the body realizes that this is not normal, and it sends certain cells in there called macrophages to try to get this cholesterol out. The body doesn't do a very good job of getting the cholesterol out, and what ends up happening is these cells engulf the cholesterol, ends up turning it into calcium.
Okay.
The calcium hardens, and that's where we get the term hardening of the arteries.
Okay.
Now, cholesterol buildup in the heart arteries doesn't show up very well on coronary artery calcium scoring, but calcium is a very dense, hard, chalky substance that is easily seen with non-crasted CAT scanning. So what we're able to do with coronary artery calcium scoring is pick up coronary disease before it becomes clinically evident, thereby picking up coronary disease earlier.
So the CAT scan sees the calcium.
That's right, and the calcium is a guilt by association. Wherever there's calcium, there's probably cholesterol.
Okay.
And that gives us the indication that we need to do something. It also gives patients more impetus to stay on their cholesterol medicine, eat right, and exercise when they know that they have the early stages of coronary disease.
So that screening, you might not have symptoms of any kind.
Absolutely.
But it can say you've got calcium in
Right.
your heart, look out.
Yeah. Calcium scoring is not a test for somebody having chest pain. Calcium scoring is the perfect test for someone who has risk factors for coronary disease, specifically a family history of coronary disease, because we're able to look at your heart arteries directly and pick up earlier coronary disease. People talk about stress tests. Stress testing is only going to pick up a tight blockage, meaning a heart artery that's blocked up probably 75% or more.
Okay.
A 50% blockage will not be picked up
Okay.
by a stress test, but
Okay.
calcium scoring will help us identify coronary disease earlier, help prevent heart attacks, and help people have longer, less incapacity and better lives.
That's a great test. Let me just stop right here. If any of you who are watching this, you have the family history of heart disease and maybe some other of these risk factors that Dr. Harkins has talked about, those screenings are available. You can call our Baptist Health Line to schedule those, either one of them, the Everyday Heart Day and the calcium scoring screening. The number's the same, 601-948-6262, or if you're out of the Jackson area, 1-800-948-6262. So we're going to move on now, but I'll come back later and give you that number, but those are the screening numbers in case that's piqued your interest. Let me just go ahead and give you that information right now. I'm going to check some questions in just a second, but a test or a term I've heard in connection with heart disease is C-reactive protein, or CRP. Can you tell us what that is and what that means?
The C-reactive protein, or the highly selective C-reactive protein, is a marker of inflammation. It's a blood test.
Okay.
You draw some blood, you check for this specific entity in the blood, and it has been associated with coronary atherosclerosis. CRP is a marker of inflammation.
Okay.
Patients with arthritis have high CRP levels, but patients who have higher levels of CRP have been associated with higher risk of coronary artery disease. This test is it is a nice test for a marker of inflammation. A lot of people in cardiology are confused as to what to do with it, because there are basically two things you can do to get your CRP down. Diet and exercise is one way. The other way is statin medications, cholesterol medications like Zocor, Lipitor, Crestor, things like that. In my opinion, is coronary artery calcium scoring is a much better way to risk stratify and screen patients, because we get a direct visualization of your coronary arteries, and the cost is probably about the same.
we didn't mention that the calcium scoring screening here at Baptist is $100, so that's the cost on that. One other question that I have, I've heard some people talk about, is there any relationship between alcohol consumption and heart disease?
It's known that people who smoke have higher risks of coronary artery disease, and that's a given. Alcohol does not have any causative effect for coronary artery disease. In fact, studies have shown that mild alcohol consumption, meaning 1 to 2 alcoholic beverages 3 to 4 times a week, actually has a beneficial effect on your cholesterol profile, which in turn will help reduce your risk of coronary artery disease. There's been a lot of reluctance in the medical community to talk about this because we don't want to encourage excessive alcohol consumption. But studies have shown that low to moderate usage of alcohol, and it doesn't have to be red wine, it can be any form of alcohol, but we're talking 1 12-ounce beer, 1 shot glass of whiskey, or 1 glass of wine 3 to 4 times per week is beneficial for your cholesterol profile and helps lower cardiovascular risk.
What about excessive alcohol?
Obviously, once you get over 2 alcoholic beverages a day, your risk from a social standpoint with arrest and car wrecks, it goes up, as well as liver problems. So if you're going to drink, you need to do so in moderation.
So the benefit is just for moderate consumption.
Right. Basically, what it does is low dose alcohol consumption will help raise your good cholesterol.
Okay. Well, I've been signaled that we have some questions, so let me refresh my screen. We'll get to those right now. Pause us, excuse us while we do that. There we go. Okay. All right. Our first question from Dana. Dana, thank you for sending in this question. Is pain at your neck and in between your shoulders a sign of heart issues? And what are symptoms of congestive heart failure? And she thanks you for your time too.
Two-part question. Sometimes pain in your neck and between your shoulder blades can be indicative of coronary artery disease. There are 2 groups of patients that really are difficult to pinpoint what the problem is based on history. One is diabetics and the other is women. A lot of times these 2 classes of patients just don't present the way that is described in the textbook. So it all depends on the situation. Generally problems related to the heart are going to get worse with exercise. So if you notice that, well, I only notice this neck pain whenever I get out and walk, then that may be a consideration. But if you notice that it's only related to when I sleep on my left side with 1 pillow, then there may be something musculoskeletal.
Okay.
But we have learned here over the last 10 to 20 years that we have to be a lot more diligent in our history taking with women and diabetics because they do not always present the way the textbooks have described in the past.
Okay.
Now the second part of the question, symptoms of congestive heart failure. Congestive heart failure is a symptom complex where the heart is really not able to meet the metabolic demands of the body, meaning the heart can't get enough oxygenated blood around the body well enough to prevent symptoms. Now some of the symptoms you have are shortness of breath, either with exertion or with lying down, swelling on your legs. Those are 2 of the main symptoms we see with congestive heart failure. Some people may have problems where they are sound asleep and they wake up in the middle of the night, short of breath, they have to sit up on the side of the bed. And that too is another symptom of congestive heart failure.
Do you recommend for Dana maybe one of these screenings, maybe the Everyday Heart Day, or maybe do you think that's a...
Well, it just it depends on her age and other risk factors, but it certainly is an inexpensive way to assess that.
Okay, all right. We have another question.
All right.
Ginger sent this question. Thank you, Ginger. Are the guidelines regarding family history you're given any different for women? So she's following up on the question.
Yeah, generally, the general rule of thumb is that women are going to develop heart disease about 10 years later than men, and most of that is due to the protective effect of estrogen.
Okay.
But, I would use the same guidelines for women, especially those with a strong family history of coronary disease.
Right.
The earlier we can pick it up, the less likely you are going the less likely you are to end up seeing me or having a heart attack.
Okay. And I'll pose this question to you. Before our webcast today, I posted information about this on my personal Facebook page, and one of my Facebook friends wanted me to find out if there's a relationship between heart disease and sleep apnea.
Yes. Sleep apnea is a condition where, due to relaxation of the soft tissues in the throat area at night, basically your breathing is stopped. And symptoms of sleep apnea are excessive snoring, episodes where you'll snore for a while and then you'll stop breathing. And the problem with this is that it leads to not a good night's sleep. People wake up hundreds of times during the night and really never get that deep, restful sleep that you need. And it can end up, causing problems with the heart, especially the right side of the heart, which can lead to congestive heart failure and pulmonary hypertension.
Okay, so sleep apnea is a different risk for heart issues.
And some of the symptoms, like I said, snoring, apneic spells, or stop breathing. If your spouse notices that, hey, he's snoring and then he stops breathing, then he starts snoring louder, that's an indication. And then some people have what we call excessive daytime somnolence, meaning they just fall asleep at the drop of a hat if they're just sitting in a quiet room. Those are all clues that you may have sleep apnea.
Okay.
And the way you diagnose that is with a sleep study.
Okay, all right. Well, I'm going to check one more time for questions. I'll refresh this. Excuse me. Let's see. All right, we're doing good on questions because we don't have any more right now. So let's just make sure we've covered everything, and if we don't have any more questions, we'll wrap it up.
Right.
But my question to you would be, so somebody has a family history of heart disease. They know they've got the risk factors. Maybe a little bit in denial. I won't go to the doctor. I won't get it checked out. I'm afraid to find out what I'm going to find out.
Right.
So I'd rather not know. And so years go on with no checkup, no, just total denial. What would you say to a person like that just don't want to maybe deal with the fact that they may have something they need looking at?
Well, there's an old saying, prevention is worth, an ounce of prevention is worth a pound of cure, and that's so true in coronary disease. The earlier we can find it, the less likely you are to end up with a heart attack, which can lead to heart failure and shortening of your lifespan.
Mm-hmm.
If you do have these risk factors, you need to make sure they're adequately controlled. Coronary artery calcium scoring is a great way to see whether or not you have any coronary disease, a little coronary disease, or a lot of coronary disease. And I would just encourage everyone out there with these risk factors to talk to your doctor about them and get the appropriate screening done so that you can help prevent any problems down the line.
There are good medicines for addressing some of these.
Absolutely. There are lots of medicines out there, but specifically antihypertensive medications, anti-cholesterol medications, and aspirin.
Mm-hmm. So if you find out something, oh, my blood pressure is high, oh, my cholesterol is high, it's not something to panic about, but it's something to take measures.
Ignoring it will not make it go away.
Okay.
The best way to treat it is to face it head on. A lot of times people are able to avoid medications with changes in their diet and their lifestyle.
Mm-hmm.
Exercise is extremely important. 20 to 30 minutes of walking a day, reducing your body weight by less than 10% can have a tremendous effect on your glucose control, your high blood pressure, and your cholesterol.
Okay. All right. I'm sorry, I'm getting a message over here. I think, do we have another question? No? Okay. All right. Well, Dr. Harkins, we're gonna wrap it up then. But just one last thing. Just a reminder for our viewers, if you're interested in either one of these screenings, the Everyday Heart Day screening or the calcium scoring screening, both screenings, same number, 601-948-6262 or 1-800-948-6262. They can schedule either one of those screenings for you. The Everyday Heart Day is $25, and the calcium scoring screening is $100, which sounds like maybe a lot more, but for a CAT scan, that's still a very good value. So Thank you for tuning in today. We're going to sign off now. Dr. Harkins, thank you so much for joining us today and
You're
for this
welcome.
great information. We are very appreciative. We hope that you will tune in again next month. We're going to have our next webcast on August the 12th, and we hope to see you then. Thanks so much.